Welcome everybody. Welcome both for those in person who have joined us and battled the elements tonight. Thank you very much, and also welcome to everyone who's joining us online this evening. Delighted to welcome you all here for the latest in our Discover series, Physical Activity as a Medicine in Cancer, delivered by Dr. Sam Orange, who I'll pass over to in a second. For those who haven't been to a Discover event before, our events work the advancement team, the alumni engagement team here at Newcastle University, and the Discover series aims to keep you up to date with latest in university research and support you with practical life skills. So without further ado, I'm going to hand over to Sam.
Thank you very much. Good evening, everyone. Really happy to be here, so thank you for being here too, particularly amid the pretty terrible weather. So you heard, my name's Sam Orange, and I'm a clinical exercise physiologist here at Newcastle University. And that just means that I support people with health conditions to be physically active, to hopefully improve their health, their well-being, and their outcomes. And I'm particularly interested in supporting people who've been diagnosed with cancer to be physically active. And that's what I'm going to be talking about today, physical activity as medicine in cancer. I'll talk a little bit about the potential role and benefits of physical activity right across the cancer continuum. So right from prevention through to longer term remission and recovery. But first, if you indulge me for a couple of minutes, I'm going to talk to you a little bit about my background and how I got here today. So in May 2020, I came here as a lecturer in clinical physiology in the Faculty of Medical Sciences. I'm sure I don't need to remind anyone what was going on in May 2020, which made for a pretty interesting start here at Newcastle. So my journey, if you like, here started around 12 years ago. In 2011, when I started an undergraduate degree at Yorkshire John University in sport and exercise science. Now, I am going to speak candidly with you and say that I wasn't interested in going to university at all. I live in York, it was a local university, and it was very much plan B for what I really wanted to do, which was continue playing rugby. Now there I am, a picture of me gripping the ball as hard as I can as an 18-year-old. So up here, you guys play that strange rugby where you jump on each other and you kick the ball a lot. Where I'm from in Yorkshire, we play rugby league, and here I'm playing for the professional rugby league team, Castleford Tigers, and that was all I wanted to do. Really, all I lived and breathed for a long time. Between the ages of about 17 and 21, I had several season-ending injuries, 3 knee reconstructions, a shoulder reconstruction, and a broken vertebrae. And I decided I'd spend the best part of my late teens and early 20s having surgery, trying to rehab, getting back on the pitch and getting injured no matter how hard I tried. And I felt actually again, I'm going to speak candidly, I felt actually really lost. I felt at that point, I felt like I'd lost my identity because everyone knew me as a rugby player. That's what I did. So I did what all students do, or most students do when they really don't know what to do. I did another degree. So then I thought, what I'm going to do, okay, I'll do another degree. I went to Northumbria University and started a master's in exercise science. And from then, I really never looked back. I had a really great time, actually, particularly my third year as an undergraduate student and a master's student. And I was really interested in potentially using what I'd gained in skills and knowledge and experience through sport and exercise to help people who may be able to benefit from that. And I take my position as an academic very seriously, my responsibility that I have in that I'm able to generate research evidence that can actually change outcomes for the better. And I take that privilege very seriously. And that's what really gripped me. And from there, I was offered a PhD studentship at the University of Hull, which I started in 2015. In 2018, I finished that. And then went again back to Northumbria University, from 2018 to 20. And then in 2020, I came over here to the Faculty of Medical Sciences. And really, so what you guys can take from that is that I've never had a real job. And here I am. And from a PhD in 2015 through to a postdoctoral researcher, and here as a lecturer, I've really specialised in supporting people who've been diagnosed with cancer to be physically active. That's what I've been really interested in. And that's, again, what I'm going to address this evening. So these are the specific questions that I'm going to go through quite systematically over the next 30 minutes or so. Firstly, does physical activity reduce cancer risk? Secondly, if it does the type and amount of physical activity matter? And thirdly, can physical activity improve outcomes after a cancer diagnosis? And for that third question, I'm going to talk again a little bit about the potential role of exercise at key stages across the cancer continuum. And I'm also going to draw on some of the research studies that I've been involved in, either previous to Newcastle or currently at Newcastle University. And given that October is Breast Cancer Awareness Month, I'm going to talk to you about a project that I'm really excited about that actually started officially on Monday. And that's a project that we're trying to develop an exercise referral from the breast cancer clinic after treatment into community-based exercise support services. That project is called PureX. Now, when that was funded, so that starts for 3 years, that's funded by Breast Cancer Now. When that was funded, someone pointed out to me that it sounds very much like Durex, the contraception brand. And I thought, yeah, do I change it? But actually, it was funded and I'm going with it. I quite like it. So the first question that I'm going to address, I'm really going to try and draw on the best available scientific evidence here, is does physical activity reduce cancer risk? Well, I always like to just get straight to the point. And there is strong evidence that being physically active, regularly physically active during adulthood, throughout lifetime, reduces the risk of developing breast cancer, colon cancer, and endometrial cancer. There's also good evidence, not quite as strong as those three cancers, but there's also some good evidence, some pretty convincing evidence that physical activity reduces the risk of stomach, esophageal, bladder, liver, and kidney cancer. So being physically active throughout your lifetime reduces the risk, lowers the risk of developing these 8 site-specific cancers. Particularly, the evidence is strong for breast, colon, and endometrial. Of course, that may at least partly be driven by because particularly breast and colon are common cancers, so we're able to generate more evidence in those areas. There's also convincing evidence that physical activity doesn't impact certain cancers. So there's no association between being physically active and the risk of getting rectal cancer or prostate cancer. Rectal cancer is a particularly interesting one because if you notice, the evidence is really strong for the benefits of physical activity for reducing colon cancer risk, but there's no impact on rectal cancer despite being, of course, part of the same gastrointestinal tract, and we don't really know why that is. We don't really understand the mechanisms of how physical activity reduces cancer risk yet, so we don't really know why there's no association with rectal cancer. There's also no association with prostate cancer. That seems to not really be driven by any lifestyle factors and more driven by family history and luck. Now, this doesn't get spoken about very often. As exercise physiologists in particular, we think exercise will cure everything. But actually, being physically active increases the risk of skin cancer. Of course, there is a reasonably obvious confounding variable there, and being physically active sometimes occurs outside. Hence, there's an increased exposure to the sun. And with a reasonably obvious confounding variable becomes a probably more obvious antidote, if you like. So being physically active outside, make sure you use proper sun cream. And there's also so much we don't know about physical activity and cancer risk too. So we know it reduces some cancers, we know it increases skin cancer risk, we know it has no impact on some, but there's so many other cancer sites out there that there might be some preliminary evidence that's building around physical activity and the risk of getting these cancers. But actually, there's not enough evidence to say either way whether physical activity is beneficial. For instance, there is some growing evidence on things like on cancers like pancreatic, head and neck, ovarian, lung, blood and brain cancers, but nowhere near enough evidence to make a conclusion from those. So to briefly summarize that first question, Physical activity reduces the risk of developing 8 site-specific cancers at least, with evidence particularly strong for breast, colon, and endometrial. It doesn't have an impact on the risk of rectal or prostate cancer. It increases the risk of skin cancer. Take proper skincare. And there's also so much we don't know about physical activity and risk of other cancers. Now, an important side question, if you like, is what is the size of the risk reduction? Because we're playing in a different ballgame if physical activity reduces the risk of 100% of these cancer sites, so it stops you getting cancer completely on these sites, or if it just has a minuscule impact. We're really asking a different question there. So the size of that risk reduction is really important too. And that very much depends on the cancer site. So it differs between cancer sites, even with different within the actual organ itself. So for instance, physical activity has a greater association with the proximal side of the colon and less of the distal side. So it very much depends on the cancer site, but generally there's around a 10 to 20% reduced risk of getting these types of cancers. And I just want to try and put that into what actually that means in real terms. So if you take a group of people at random who aren't physically active, and you take a group of people who are physically active, that highly physically active group will have around a 20% reduced risk throughout their lifetime of developing these cancers. And again, I'm just going to take one slide just to show you what this means in absolute terms, because it might not be everything that we sometimes think it is. So let's take colon cancer, for example. If you take a random sample of 100 people from the population, approximately, depends where you live and what part of the world you live in, but approximately 4 out of those 100 people during their lifetime will develop colon cancer. We know that being highly physically active, so being in the top category of physical activity in a population, reduces the risk by up to 20% of developing colon cancer. So then if you take a group of people from that category of being highly physically active and you track them, you take 100 people and track them throughout their life, 3 of those 100 people will develop colon cancer, because approximately 20% of 4, just over 1. So we've got 3 there. So there's two take-home key take-home messages from that. Now, I couldn't be more of a champion of physical activity. I'd be really, really lost without it. It brings so many benefits. And as I said, it really helps me on a day-to-day basis. But it's not the magic bullet that sometimes gets shoved down our necks, particularly by people like me, exercise scientists. And there's 2 key messages there. One, that if you are highly physically active, that is fantastic. You still can get cancer. Doesn't mean you're not going to get cancer. It reduces the risk of it, but you can still get it. And I see when I've written articles, for example, for websites, or some news outlet has published some of our research, you usually get a lot of comments. And what usually you get, well, that's a load of rubbish because my aunt's friend is really active and she got cancer. And so I think it's an important message that physical activity isn't going to stop cancer, but it does lower the lifetime risk. The second message is that also means if someone gets cancer and they are not physically active, it's not their fault. It's not their fault for not being physically active. And I think those are 2 important messages that come from knowing about actually what impacts physical activity has. So we've answered that first question. And again, I'm pretty confident that you guys will be able to answer that question as well. So I'm going to talk a little bit about the type and amount of physical activity and whether that matters for our risk of getting these certain cancers. So typically, the type of physical activity gets broken down into 4 domains. First one is occupational physical activity at work. Leisure time physical activity, and that tends to be referred to as exercise. So I might use them terms interchangeably sometimes, but leisure time physical activity is exercise, planned, structured activity, purposefully carried out to improve health or fitness, going for a run, going for a jog, going to the gym, for instance. Household physical activity, doing your chores. Need to remind my partner about that one. And hope she doesn't watch this recording. And transport physical activity. So if anyone, terrible weather, if anyone walked or cycled here today, for instance. Now, the evidence shows that all types of physical activity is beneficial for prevention. So it doesn't matter what type of physical activity you're doing, it all contributes to reducing your risk of developing these specific cancers throughout adulthood. But the evidence is particularly strong for leisure time physical activity, aerobic physical activity in the leisure time, going for a run, again, going for a jog, playing tennis. There's something special, and not just around reducing cancer risk and other health outcomes as well. I think there's something particularly special, supported by the evidence, about taking a purposeful decision to go out and be consciously physically active rather than incidentally. Again, all beneficial, but there's something particularly special about a purposeful bout of physical activity. Might be because how hard you work, the intensity that comes at, rarely is it below moderate intensity. And maybe there's something else about taking that actual decision to be physically active has other health benefits too. So does the type of physical activity matter? I'm going to talk about, does the amount of physical activity matter? Do we have to do a particular amount of physical activity for it to be beneficial? And the other way, is there an amount of physical activity that if we go beyond, we get no additional benefit? Those are, again, two important questions. I'm going to answer that question with a graph. So you can, this is a graph from I've modified from a big pooled analysis that was published a few years ago. And you can see here on the y-axis is the amount of risk reduction, and on the horizontal axis is the amount of physical activity. So you can see here, also in the blue shaded area, is the recommended amount of physical activity, which, following national and international guidelines, is 2.5 to 5 hours of physical activity per week. So you can see by this graph that doing 2.5 hours of physical activity per week reduces the risk of breast cancer by 6%. Doing 5 hours reduces it by 10%. Doing more reduces it further. So again, there's two key messages to take from that. Firstly, the first thing you can see, there's no horizontal blue line, i.e. there's no minimum amount of physical activity that doesn't bring a benefit. When you look at that, the line of that risk reduction, even the smallest amount of physical activity, less than the recommended amount, brings benefits to the risk of developing breast cancer, for instance. So all amount of physical activity is beneficial. But it also shows that more is better. So the more physical activity you do, the more benefits that come. Eventually, you might expect that to level out, but right up until 10 hours of physical activity per week, which is a hell of a lot, the benefits keep coming. The same can be said for colon cancer, and the same story is evident for endometrial cancer as well. Again, all physical activity is beneficial, but the more you do, the better benefits, the more benefits that it brings. I'm just going to summarize that briefly here. So again, that important question, do the type and amount of physical activity matter? Because we know physical activity does reduce the risk of certain cancers. Well, all physical activity is beneficial, no matter what type, but there's probably something special about aerobic physical activity or aerobic exercise done in leisure time. Any amount of physical activity is better than none. So any amount, getting up, and I think that's a nice message, sitting down less is beneficial, but more is better. So back to our questions, and I feel like we've adequately answered the first two. On to the third question now. So can physical activity improve outcomes after diagnosis? Of course, here we've been talking about prevention of cancer, but there may be a role for physical activity after cancer diagnosis as well. Now, 1 in 2 of us will be diagnosed with cancer, some cancer in our lifetime. After a diagnosis of cancer, some people will receive treatment for that cancer, and some people will recover and enter full remission from that cancer. Of course, not everyone who's being diagnosed will receive treatment, and not everyone who receives treatment or is diagnosed will fully recover either. But I've displayed the cancer pathway on here in these key stages because physical activity can potentially play a role in improving outcomes right across these key 3 stages of the cancer continuum after a diagnosis. And I'm firstly going to talk about that first stage after being diagnosed with cancer. Now, typically, there is some time between a cancer diagnosis and having treatment. That might be around 4 weeks, of course, depends upon the cancer and the cancer stage and many other factors. But typically, there might be around 3 to 4 weeks between having a diagnosis of cancer and receiving treatment. Now, cancer treatment, for instance, surgery, radiotherapy, chemotherapy, and of course there are other therapies now, things like immunotherapy, particularly those 3 mainstream cancer treatments really have a huge physical toll on the body. So they elicit a physical trauma on the body, and it's actually being compared to things like running a marathon. So when you look at the metabolic changes, the physiological and physical changes that occur in the aftermath of surgery, major surgery, it's not that dissimilar to the physiological metabolic changes that happen after a marathon. I've never done a marathon, by the way, as a caveat. People who have tell me. And we would always train for a marathon or a big exercise event like that, right? It's actually unsafe not to. We would always train for that. And so the idea here is training to be able to prepare the body physically to withstand the trauma of the upcoming treatment. You can see that nicely here by the green line. Between a diagnosis and receiving treatment, the idea here is to improve physical fitness, or what we sometimes refer to as physiological reserve, to be able to withstand the trauma of treatment, for instance, surgery, and then recover faster afterwards. And there is a growing evidence base on this. This has been really, really popular on the academic field over the past 15 years or so. And it's actually ASCO, the American Society of Clinical Oncology, massive cancer organization in America. And they've summarized the evidence on this. And in particular, in the context of surgery, where the evidence is most abundant, and for lung cancer and for bowel cancer, colorectal cancer, the evidence shows that what we call prehabilitation, so being physically active after a cancer diagnosis and before treatment, in that lead up to treatment, can reduce the number of surgical complications. It can reduce the time spent in hospital, and it can increase the restoration of fitness afterwards, as you can see illustrated by the green line. Also can give a real sense of control to people who've been diagnosed with cancer. Because I work with a lot of people who've been diagnosed with cancer as part of various patient and public involvement groups with attached to my, or very much a part of my research. And a big thing that they typically say is, of course, after a cancer diagnosis, there's lots of things that can't be controlled. It's scary, lots of things that can't be controlled. For some, physical activity to try and take a small amount of control over prognosis and outcomes, sometimes that can give a sense of ownership and control over their outcomes. Now, I started involvement on this trial before I came to Newcastle, and I'm still involved in it now. This is the biggest, what we call prehabilitation trial in the UK, to be honest, if not worldwide, that we call Prepare ABC. This is led by Professor John Saxton who was at Northumbria and now he's at University of Hull. And what the trial did was recruit 650 patients with bowel cancer scheduled for surgery. And they randomly allocated those patients to either hospital-based supervised exercise. So I delivered a lot of those exercise sessions at Newcastle anyway, Northumbria Trust. Home-based exercise, where the patients would undertake it themselves at home, or standard care without exercise. And some of the important outcomes that we looked at were surgical complications, and length of hospital stay. And we also measured up to 12 months after surgery, quality of life and physical fitness. I would love to share the results of this study because it very much will be the authoritative, nationally, internationally trial in this area. But recruitment has actually only just, or I say recruitment, follow-up has recently finished, and we're just analysing that data at the moment. So we don't have results for you yet, but stay tuned. Okay, so for some people, after a cancer diagnosis, they will receive active treatment. And physical activity may be able to play a role for improving outcomes in this context as well. For cancer and its treatment, you may well have experienced it either yourself or through significant others. It can really evoke some very challenging and quite awful side effects. Fatigue is a real common and challenging side effect. Other common ones are symptoms of anxiety, depression, reductions in overall fitness and function and strength, and ultimately reductions in quality of life. There are many other side effects too: nausea, vomiting, constipation, hot flushes, for instance. These are some of the common ones that actually there is good evidence that physical activity can help manage some of these side effects here. So there's been full randomized control trials of people going through treatments such as chemotherapy that have shown that being physical activity intervention can reduce the extent of some of these side effects. And I'm going to just take a couple of slides to talk a little bit about fatigue, because that, again, speaking to people who've been diagnosed with cancer and had treatment, this is really, really prevalent. So cancer-related fatigue is diagnosed as distressing, persistent, subjective sense of physical, emotional, or cognitive tiredness or exhaustion related to cancer or its treatment that's not proportional to recent activity. Essentially, it's real tiredness that can't be restored by, for instance, stopping activity or sleep. And the evidence shows that 9 in 10 people diagnosed with cancer will experience cancer-related fatigue at some point across that cancer pathway. So it's really, really quite debilitating and really, really common. Now, there was a big pooled analysis a few years ago now that looked at the effects of exercise, psychological interventions, things like cognitive behavioral therapy, and drugs to treat cancer-related fatigue in people undergoing cancer treatment. What the pooled analysis was, again, they pulled all the evidence base together, and what they found was that actually exercise and psychological interventions were effective for improving cancer-related fatigue, and they were far superior than any drug-related treatment. And so thus, even though it can seem very counterproductive, being tired and then being physically active, and of course that comes with its challenges and difficulties, actually being physically active is one of, if not the best thing that people can do with cancer-related fatigue. So it really does have a key role. Physical activity is never going to cure cancer. If you have cancer, you need to have treatment, but it can play a role in helping managing some of those adverse effects of cancer and its treatment. It may also be able to benefit other cancer treatments as well, not just what's being looked at mostly, which is chemotherapy. So involved in a trial called, that we published a couple of years ago, called Proscardio, where we randomly allocated 50 patients with newly diagnosed prostate cancer starting hormone therapy, also known as androgen deprivation therapy, which is essentially chemical castration. It stops men producing testosterone, because testosterone can drive prostate cancer growth. We randomized those patients to 6 months of aerobic and resistance exercise or 6 months of standard care where they didn't receive any exercise. And of course, I'm biased, but what was really novel about this trial was that the patients were referred androgen deprivation therapy, or prescribed rather, they were prescribed hormone therapy. And at the same time, in a similar manner, they were then prescribed exercise too, to try and manage some of the known established side effects of androgen deprivation therapy. And after 6 months, what we found was an increase in rating of quality of life by patients. and a reduced risk of, based on an algorithm, a reduced risk of developing a adverse cardiovascular event like a heart attack over the next 10 years. So we found some real benefits there, despite a reasonably modest study. And quite randomly, this study is actually now played a key part in national prostate cancer rehabilitation guidelines in Denmark. Who'd have known? Newcastle University, they told me and sent me the policy document from the Danish health authorities, prostate cancer rehabilitation guidelines, and this study has formed the basis to support those guidelines. So for some people who have treatment, they will then enter remission and longer term recovery from their cancers. And I'll again just go through a couple of examples of drawing on the best available evidence of how physical activity may play a role in this context as well. So we've gone through some of the side effects and symptoms of cancer and its treatment, and they're up here again: fatigue, symptoms of anxiety and depression, physical function and strength, and reduction in quality of life. And actually, there was a survey by Breast Cancer Now, and some of the women I speak to corroborate these findings, that a good proportion of women who've had breast cancer and then received treatment, the majority of them will survive their cancer, which is fantastic. But a good proportion, I have to say, the hardest time was finishing treatment, because it was there was such a period of intenseness. It feels like a bit of a blur. Then you finish treatment, you're in remission, great, and almost feel a little bit lost and abandoned from that service, despite having all these side effects still very much prevalent that can last for weeks, months, and years afterwards. And in fact, we have a patient, one of our patient representatives on a trial that I'm going to talk about in a moment. We're actually doing some filming for BBC Look North, and someone said to the patient representative, "Oh, fantastic, you finished treatment. Oh, you got through it, fantastic." And she was like, and of course, that's not a dig at the person who said that, but the patient representative who replied was like, "Well, not really. You know, this is still killing. You know, it's still very, very difficult to manage, and these side effects can really last for a long time." Now, physical activity can play a role in managing some of those side effects. And again, just like during treatment, that there's good evidence from trials showing that being physically active after cancer treatment can help manage some of these what we call late effects or longer term side effects. There's also some accruing evidence, very interestingly, particularly in breast cancer, again, perhaps because we can get the most data from breast cancer because it's the most common cancer, that being physically active after a diagnosis and after treatment can help reduce the cancer coming back, reduce the likelihood of it coming back, and extend cancer-free survival. Excuse me. So there is some, and that mainly comes from observational evidence at the moment, but there is some accumulating evidence that physical activity may play a role and actually be able to affect essentially what we call cancer control outcomes that can not just improve things like fitness and quality of life, but can actually reduce the risk of some cancers coming back. So to summarize, some of the roles that physical activity, based on the best available evidence, can play during key stages across the cancer continuum. After a diagnosis and leading up to treatment, physical activity can maximize fitness before treatment and improve treatment outcomes, such as improving recovery afterwards and reducing the amount of complications in surgery. During treatments like chemotherapy, hormone therapy, and others, physical activity can help manage some of the adverse side effects and symptoms of cancer in its treatment. And into the longer term recovery phase, for those who are fortunate to get there, physical activity can help manage the late effects and the lasting side effects and symptoms of cancer in its treatment, and potentially lower the risk of cancer recurrence. This actually led to major worldwide health organizations to publish cancer-specific exercise guidelines. So the guidelines from the American College of Sports Medicine for people during and after cancer treatment are to do aerobic exercise 2 to 3 times per week and do muscle strengthening activity twice per week too. Now, they also acknowledge that Sitting down less is beneficial, all movement is beneficial, and exercise guidelines are neither suitable or appropriate or achievable by everyone. But as a goal to maximize the benefits of exercise, there are guidelines published. We've answered those 3 questions now. I hope you guys are able to answer those as well. And I'm going to talk to you about a new project, just very briefly over the next 5 minutes or so to finish, of a new project that's just started this month, and again that I'm really excited about, called PureX. Breast cancer is now the most common cancer in the world and in the UK. So it overtook lung cancer recently as the globally the most common cancer. 55,000 women every year in the UK will be diagnosed with breast cancer, and that translates to 1 in 7 women in their lifetime. So it's very common, unfortunately common disease. Fortunately, that survival rate, due to vast improvements in early detection, screening and treatment, survival rate has come on considerably over the past few decades. So the 10-year survival rate about 40 years ago was 40%, but nowadays around 8 in 10 women who are diagnosed with breast cancer will live for 10 years or more. And that's fantastic news, and that's real testament again to advances in medical treatments. The problem comes, we've talked about the symptoms and side effects of cancer and its treatment, that some of the data shows that over half of women who are diagnosed with breast cancer will experience symptoms of anxiety or depression in the year after diagnosis, and 1/3 will experience elevated levels of fatigue up to 10 years after diagnosis. It can really stick around. Ultimately, that leads to a difficulty in returning to normal day-to-day activities, difficulty in returning to work, and a reduction in overall well-being. So surviving breast cancer doesn't always mean living well, and that's a real problem. Now, we've just talked about, and I'm not going to go over again, the potential benefits of physical activity during and after cancer treatment. By managing some of the side effects and potentially, particularly breast cancer, lowering the risk of the cancer coming back. Now, some of our work has shown that despite physical activity being potentially one of the best things that people can do, women who finish breast cancer treatment can do for their well-being, despite one of the best things it can do, less than 1 in 5 women recall that they've received any sort of information or a discussion on physical activity by their health professionals after treatment. Of course, that's due to several reasons. The NHS is under such a lot of burden, and health professionals already do such an absolutely incredible job without having to think about physical activity guidance as well. And that's where we come in, and we want to be able to support health professionals and be able to change that. So this is the project. It's called PureX, or Expanding into Communities to Improve Lifestyle Support for Women After Breast Cancer. It's all about trying to take away that burden from the health service and trying to expand our level of support into communities. So we want to develop a program to improve women's access to physical activity and diet support after finishing treatment for early stage breast cancer. We want to do that in 2 ways. We're going to be creating a new referral pathway linking breast cancer follow-up care with community-based exercise services. Essentially, what that'll look like will enable health professionals to make a quick, easy and simple referral from the cancer clinic, maybe at the end of the treatment consultation, into a community exercise service, i.e. one of the best things, fantastic, you're now in remission, one of the best things to be able to do to recover well after cancer and its treatment is to be physically active. One great way to be supported to do so is join a peer group with other women who've had breast cancer to exercise in the community. There's actually, you live in X, there's actually a service there's a community service just nearby. Can I book you an initial appointment and so we'll be in touch? Something around those lines. And then, based on the fact that there are a lot of community exercise services out there already, Newcastle University offers lots. Exercise classes for older people, for instance, exercise classes for the general population. There's lots of exercise classes out there already, but what we can't do is expect women who've had breast cancer with unique physical and psychosocial needs to go to a non-bespoke exercise class. So what we're trying to do is acknowledge there's an infrastructure there already, not build something from scratch, which people have tried to do. We want to create a training package to support or train community service providers how to adapt their existing services specifically to deliver those services to women with breast cancer. So we want to take an efficient approach that's, we can take this training package potentially nationwide and train the existing community services who are already there to be able to tailor their services for women with breast cancer, essentially upskilling those services. And this is what the trial, 3 years will culminate in a trial, and this is essentially what it will look like. So we're working with a community health charity called HealthWorks. If you haven't heard of them, have a look. They do some absolutely brilliant work in the Northeast. A community health charity doing some great work with marginalised groups, for instance, through health information and a lot of other things. And the chief executive is actually here today. Hi, Paul. I've got to be nice because I'm hoping he'll get a drinks in after tonight. So we're working with HealthWorks, and they're an absolutely fantastic charity, and they already offer exercise services. So what we want to do is train HealthWorks practitioners how to adapt their services they already offer for women with breast cancer. We want to start the trial where we recruit around 40 women after they finish treatment for early stage breast cancer. Those women will be referred by a health professional during their follow-up appointment into a 12-week exercise program that's then delivered by HealthWorks practitioners after they've received our bespoke training. Women complete the exercise program. Given this is an initial early phase study, we'll complete an evaluation where we're looking at things like feasibility and acceptability. Do women enjoy it? Did they turn up to the exercise? Did they take part? Did the health professionals think that referral was quick and easy to use? And can we see any preliminary changes in things like fitness and quality of life? To hopefully inform a much bigger trial where we can look at this nationwide with a lot more women. So that's the work package for the last work package of the project that'll happen in the last 18 months. And we've got quite a lot of preparatory work building up to that. And it is perhaps likely that some people in this room have been affected by breast cancer, either yourself or a significant other. And we want to be able to hear from a diversity of voices. So very much at the center of this is making sure that everything we do is very much grounded in the views and experiences of women with breast cancer and who've experienced treatment. And so if you are interested in getting involved in contributing to particularly these parts, for instance, the patient public involvement group or some focus groups we'll be running, please do feel free just to drop me an informal email. I'm very happy to chat. So I want to say thanks to all our PureX team. There's the researchers on the left here and the list of collaborators too. We're working with Gateshead and Newcastle Trust, HealthWorks, and we're funded by Breast Cancer Now, which we're of course very grateful for. And that's it for me, folks. Thank you so much for listening. Really enjoyed talking to you about that tonight. Very, very happy to answer any questions in the audience and for online as well. Thank you very much. One person, yes, sir.
I'm surprised there's little mention of nutrition.
So I like to stay in my lane. So I'm a clinical exercise physiologist, simply. So my expertise comes from exercise delivery. Nutrition absolutely plays its part, but I work with cancer dietitians who will tell me. So we are working, so PureX is actually around developing both physical activity support and diet advice. And so we've got named on a collaborator here, for instance, Isabel Bow, who's a cancer dietitian. And so I listen to, when I give a talk, I tend to not really speak about diet because it's not my area of expertise. Of course, it's very important, but I'll let the experts tell you about that basically. I think it's really important that we, as researchers, just speak about what we know about and leave, I guess, other areas to the experts.
It could be an important factor.
Yes, yeah, absolutely. Again, there's lots of different contexts, isn't there? So absolutely. So for example, maintaining a healthy weight Eating fibre, avoiding excess sugary beverages, for instance, is really good for preventing cancers. There's less evidence about how it can improve outcomes after a diagnosis, but it is inevitable that it's going to play a part. It's just very, as you can, I'm sure, appreciate, it's very difficult to accrue that evidence. We have, nutritionists and dietitians in our team that, if you're happy to share your email address with me after you've got any questions, I'd be happy to put in those questions on them. As I say, it's not my area of expertise, so I'm a little bit shy in answering things on nutrition. Thank you. I think ask for one online.
Somebody's asked if it makes a difference if you have a good level of physical activity for a number of years, but then other years not so much, sort of lower.
So my initial answer to that is I don't know. However, my hunch would be yes, because physical activity, say over a number of years, can lead to some positive adaptations that wouldn't all just go away from not being physically active. So my hunch is yes. I'm not aware of any data of, for example, being physically active for 5 years and not for 10 and the impact on health outcomes and cancer risk. But my hunch would be it still would be beneficial. And that sort of really plays into any amount of physical activity is better. Maintaining it for a lifetime is ideal, but actually any amount of physical activity is ostensibly going to help with cancer risk and improve other health outcomes.
Yeah, so great talk, thanks. I was just wondering, so you talked about leisure activity being having more evidence than other forms of activity. Do you think that's just to do with intensity, or do you think there might be other mechanisms there that might play a part in?
I think a big thing would be, I think intensity is one of them. I think there's lots of really good question. I think there's lots of things to this that I'll try and answer concisely. Intensity is one of them. I think some of the other types of physical activity intersect with confounding variables. So for instance, if you are more active in your occupation, you are more likely to live in a more deprived area, for instance, which can impact outcomes. Of course, that we're talking about general likelihoods here. That isn't hard and fast rule. The other thing is that leisure time physical activity simply is easier to measure. If I asked everyone here how many times they've gone out in the last week and done a purposeful jog, for instance, for 30 minutes or more, you could probably say either none or 2, or you'd probably answer that. If I asked you, just tell me how many minutes you've been physically active today, since you got out of bed, and that counts, that's quite difficult, isn't it? And so I think it's maybe around how well we can measure leisure time physical activity as well, rather than the other domains. But I think it's a very good question. There's probably lots of different strands to that, but those are my immediate thoughts at the moment. Hope that answers.
Yeah.
Go online.
You mentioned that PureX focuses on women who recover from early stage cancer. Is there anything covering women that have recovered from later stages of cancer?
Yeah, later, as in, I presume you're not going to be able to ask back this question. Okay. So later, so PureX covers early and locally advanced. I should have probably been more clear there. I'm going to presume that question is around secondary cancer, so living with cancer. There is some, so that is a real evidence gap, and a really, really important one that needs to be filled. There is some preliminary evidence that physical activity can help later stages of cancer. For instance, it might be able to help with things like overall well-being and fitness, functional independence, things like bone health. There's been some work on bone metastasis and how physical activity might be able to help with bone health. So there's less on it, but there is some emerging evidence that absolutely it would be beneficial. Yes.
Will the adapted package be very similar to what would happen in a class normally, or is it more the fact you can measure things that you can measure, or is just an ordinary fitness class?
Really fantastic question. And this is something I thought a lot when I was building the proposal. And most of these things look very similar. So most of them, for example, you go to cardiac rehabilitation or falls prevention program, and a lot of them look similar. Tends to be a bit of strength exercise with a bit of aerobic exercise in a circuit manner for around 45 minutes with or without some diet education. Why it's important to be able to tailor it to people with breast cancer, because those women will have specific unique needs. So for instance, they may have things like peripheral neuropathy, pain and tingling in the hands and feet. They are very likely to have mobility issues in their upper body. They are very likely to have some body image issues. They may be wearing a wig. There are lots of different issues or considerations that, for instance, if a woman was exercising, went to the instructor and said, well, you know, what upper body exercise can I do? And the instructor said, okay, I want you to do some shoulder presses like this, and couldn't understand why that wasn't possible. That's really off-putting from an exercise perspective. So the general outlook, I very much expect to be similar to a group exercise class. But I think it's more those little nuances that we as exercise instructors and people designing those exercises need to be aware of. It's those sort of smaller things, I think. Another one from the left.
Due to the challenges of cancer patients and their sort of energy levels, would physical activity be more of a challenge and have a sort of negative impact in terms of weight loss?
Weight loss is a really tricky one, a really interesting one, because of course excessive weight loss for many patients isn't good, and it's very, very context dependent. Unless I was speaking to an individual, I would never who's had cancer who I know, I would never recommend weight loss without a thorough, if you like, background check. So, for instance, I'm working with some head and neck cancer clinicians at the moment, and a big issue that they came to me about was during the standard chemoradiotherapy, they can lose 10–15% of body weight. And so, of course, what I wouldn't be saying to those patients is, well, exercise because it's weight loss, it's good for you. And so that question is very, very context specific. If there is an indication for weight loss, weight loss would be beneficial, which it is in some contexts, possibly not during treatment, I wouldn't really recommend, but afterwards maybe reduce the risk of it coming back. Personally, I don't think physical activity is the right tool to support weight loss. I think physical activity is a tool to be able to improve some of the things that I've shown: quality of life, physical fitness, function. I think is a celebration of what the body can do, not a fantastic tool for weight loss. I think that's where good nutrition comes in if it's needed. Next one in person. Yes, please.
It's been a great talk, thank you.
Thank you.
Yeah, my question sort of links in with one of the questions from the gentleman who asked the first one and one of the online questions, and it's regarding the PureX study. Yeah, I managed to not say the wrong word. Yeah, so you were very clear in the first part of your talk about the huge benefits right from diagnosis all the way through to the pathway to recovery of exercise, and surely a proportion of that, maybe quite a large proportion, would be between diagnosis and treatment. So I was curious about the timing of the delivery of the exercise program in the PureX study, and not just because of the benefits of exercise, but also because it seems that the current data points towards the diet component and intermittent fasting and time restricted eating, that sort of thing, being hugely beneficial in conjunction with cancer treatments. So I'm just asking, why is it not starting at diagnosis?
Fantastic question, and a really, really relevant question. And to digress very quickly, you asked the same question as I reached out when I was conceiving this idea to a cancer dietitian, Michelle Harvey. I'm sure she wouldn't mind me mentioning her name, who I'm actually working with on a separate project now. And I said to Michelle's very well known in the research field, you know, I'm coming with this project, do you want to be involved? And she said, well, I think you should start during treatment. And I said, I don't think this is the right place for this particular support program. And she said, well, I'll only be involved if it's during treatment. I said, okay, then fine. And it got funded anyway, which I was slightly smug about. So I think a referral to community-based support service, based on my experience of talking to a lot of women who've undergone treatment, that because of the fluctuations and side effects and symptoms of treatment, and given the logistics of a community service group exercise, which is probably Tuesday and Thursday at 6 o'clock, because of the fluctuations in side effects during treatment, that the inflexibility of those timings wouldn't be good for many women receiving treatment. And I didn't feel that would work. And that was physical activity, very good during treatment, but I didn't think that particular program, a referral to community service, was going to be the best way to do it during treatment. I felt that was the best stage when women have finished treatment, sometimes can feel abandoned. It's then another layer of support to then continue on to. I felt that was the best stage for it. Thank you. Do you have any more?
Yeah, just I think one more. Do you know why exercise helps prevent cancer? Quite a broad one.
Yeah, no, interesting question. I can answer it broadly too. So the prevailing mechanisms are around a reduction in inflammation, improvement in insulin sensitivity, so our metabolism. The problem with those two are they are heavily linked to weight, and we know that physical activity can reduce cancer risk independent of someone's body mass index. And so those two might play a role, but I don't think that they're only mechanisms. There's increased work at the moment on the immune system, how exercise may mobilize immune cells into the blood and then distribute them to other organs. So immune system, inflammation and insulin resistance. We've also done some work where we've taken blood before and after people have exercised, and that post-exercise blood contains a lot of the hormones and molecules that get released during exercise, and we've then used those blood samples to stimulate cancer cells. Again, these are cancer cells, so it's not prevention, but it's reduced progression. And what we found was those exercise blood samples can actually reduce the rate of growth of those cancer cells. So what I'm trying to say there might be something about every time you exercise, there might be something happening in your blood, proteins and hormones that get released that can actually have a beneficial effect on cancer risk. And that is actually very prevalent in things like diabetes. The benefits of exercise for maintaining blood sugar essentially come from each time you exercise, there's a change in hormones and blood glucose concentrations that helps lower blood sugar. And so there is potential that there's some more mechanisms out there that we don't have a clue about at the moment. Thanks. One more. Cool. Do you want to go? Yes, please.
I had a follow-up question about the later stages. Do you think there's any scope to implement any form of exercise during the actual treatment? Because in later stages, when you have systemic treatment, chemo or immunotherapy can last for a few months and you actually need a lot of physical reserve to get through that.
Yeah, so you're saying about physical activity during later stages of cancer, as in finished cancer treatment, or?
No, as in during the treatment, because it can last for many months. I was wondering if maybe a more toned down version of exercise or something like that.
Yeah, of course, yeah, absolutely. So yes, there's definitely a role there. And what we aren't saying here is everyone should, go and do 60 minutes of exercise per day during cancer treatment. That's absolute rubbish. But being on some days, being active might be getting out of bed. On some days, it might be walking around the block. On better days, for instance, what you tend to see is symptoms are really high in the few days after chemotherapy, and if it's chemotherapy, and then get a little bit lower and lower towards the next bout of chemotherapy. So it might be trying to be a bit more active during that later phase of the chemotherapy cycle, if you like. So yes, there's definitely a role there. Physical activity prescribed and done properly can improve physiological reserves to actually help you withstand further treatments. It's just got to be done in a progressive manner, starting slow, starting easy, and if possible, progressed over time.
Thank you, Sam. Thank you everyone as well for attending tonight, both in person and online. Thank you for contributing to a really sort of engaging Q&A there. Cancer research is really important to us here at Newcastle University, and our advancement team actively fundraises for our Centre for Cancer. So if you've been inspired by Sam's talk tonight, which I'm sure many of you will have been, we will be circulating the link if you would like to make a donation to our fundraising programmes, and we thank you in advance for that. In addition, we'll be sharing a feedback form from tonight's event. Please do complete it. We'd love to hear from you, and we'd love to hear about how you found this evening and also future topics that you'd like to see from our Discover series. You'll see on the screen, we've got a couple of events coming up. So the next in our Discover series will be delivered online on Thursday the 30th of November, and it'll be from one of our academics within the business school around the rise of the ethical consumer, so one not to be missed. And for any graduates in the room, we have our annual meeting of convocation coming up on Saturday the 4th of November, which is an annual meeting for our alumni to get together, hear updates about the new university and your broader alumni community. So we hope to see you at one of those events very soon. Just like to close saying a massive thank you to Sam again. It's been an absolute pleasure to have you deliver this talk this evening, and a massive thank you to everyone again for attending, and we hope to see you again very soon. Thank you.